Let's update where we stand regarding the coronavirus today. Hope and healing arrived in New Jersey. The state gave out its first vaccine this morning to an ER nurse. Maritza Benitez has spent the last 9 months working on the front lines, and today she made history on her birthday.
Happy birthday. Thank you, God. Thank you.
An inspiring gift for us all. This historic day comes 286 days after the state's first confirmed coronavirus case. News 4's Brian Thompson is live in New Brunswick with an update. Brian.
Yeah, Dave, and this happened on a day when New Jersey recorded its most deaths, 97, since last April. Certainly not a good sign, but there was that burst of hope today, that first inoculation, beginning with a nurse in Newark on her 56th birthday. It's the shot seen and heard around the state.
Happy birthday.
University Hospital nurse Maritza Benitez, the first in New Jersey to receive the COVID-19 vaccination. Now tens of thousands of frontline healthcare workers lining up virtually to offer them a degree of safety as a pandemic rages on.
This vaccine is safe. It has been. I wouldn't take it if it wasn't safe. I have a family too. I am just like you.
Governor Murphy calling it an incredible thrill to watch these first shots. The dark memories of last spring still fresh for Nurse Benitez.
When COVID came, it was the worst of our days. It was our worst nightmare. It was just wave after wave of critically ill patients that were coming in with no end in sight.
The Pfizer vaccine still arriving at some of the first 6 hospitals in the state to get it. This, RWJ University here in New Brunswick, with some 47 more across the state to be receiving their doses by the end of the week. At Hackensack University Medical Center, Dr. Lisa Tank was the first there to get a shot. That followed a solemn moment honoring the 300,000 plus who have died nationwide.
Please join me in a moment of silence to honor them.
But now it's a race, a full month to vaccinate most frontline healthcare workers across the state and to persuade doubters, especially in minority communities, to get vaccinated.
I will be first in line, and I will try to lead and set an example for many of those in the African-American minority community.
Benitez was first in line. New Jersey's moment of history in this pandemic, with an optimism that this war can be won.
We are going to take our city, we're going to take our state back, we're going to take our nation back from this horrific, horrible, deadly disease.
Maritza Benitez said that her daughter cried when she first found out Mom would be getting the shot, but then when she realized that Mom would no longer live in fear as a frontline worker in the COVID wards, well, she became excited and thankful. Live in New Brunswick, Brian Thompson, News 4 New York.
And we all are, Brian. Thank you. But we also have a long way to go. And for the second day straight, Mayor de Blasio said the city might need to shut down again to stop the surge. And today he offered a timeline on how to do it. He suggested going into a pause-like shutdown starting the day after Christmas. The mayor says he's hopeful it would only last weeks. This comes as the city's positivity rate is now 5.5%. The number of people in the hospital keeps going up.
I think, unfortunately, I don't say it with anything but sorrow, but I do think it's needed. We're going to need to do some kind of shutdown in the weeks ahead, something that resembles the pause we were in the spring.
Now, this comes on day 2 of the vaccine rollout across New York City. Today, nearly 41,000 doses are expected to be available at dozens of city hospitals. News 4's Andrew Siff continuing our team coverage. He's in Morningside Heights. Andrew?
Right, David, behind me, Mount Sinai, Morningside, one of dozens of hospitals in New York City getting the vaccine today. They're trying to go as fast as they can, get as many healthcare workers protected as they can, all the while before the second wave gets even worse.
Day 1 saw a careful rollout of 73 city healthcare workers getting the vaccine.
It is not just a shot you take in the arm with a needle. It is a shot of hope.
And today, the ramp up, as an estimated 41,000 doses of the Pfizer vaccine arrived at dozens of city hospitals as more doctors and nurses took their turn. This was the scene at St. John's Hospital in Far Rockaway, a facility that treated the first COVID patient in Queens way back in March.
I am so thankful that we have this vaccine for them. This certainly will bring people comfort.
I mean, it's exciting, and hopefully that'll be a big help next year.
Sean Merriweather reflected on the vaccine arrival while waiting 1 hour for a COVID test in Harlem.
I'm going to go see my family next week for the holidays. So that's, it could be worse.
Amid a rise in COVID cases across the 5 boroughs, a surge so relentless that today the mayor predicted a new pause on non-essential business will begin right after Christmas.
I think, unfortunately, I don't say it with anything but sorrow, but I do think it's needed. We're going to need to do some kind of shutdown. I think it's going to very much resemble what we saw in the spring. Essential work only.
The mayor also acknowledged it's ultimately the state's decision. Governor Cuomo has said that decision will be based entirely on hospital capacity. We're live in Morningside Heights. Andrew Siff, News 4 New York.
All right, Andrew, thank you. It's also day 2 of the vaccine rollout in Connecticut. Today, the Pfizer vaccine making its way to several more hospitals, including St. Vincent's Medical Center in Bridgeport. The first doses are going to the highest risk healthcare workers. News 4's Linda Baccaro working this story in Connecticut. We're going to check in with her in the next half hour. Moderna's vaccine could be cleared by the end of this week, which would then give Americans access to 2 highly effective COVID-19 vaccines. According to documents released by the FDA today, Moderna's vaccine is 94% effective and appears to prevent the spread of the virus. This sets Moderna up on a track for emergency use authorization by the FDA. President-elect Biden is in Georgia right now, ramping up support for Democrats in a runoff race in the state that will determine the balance of power in the U.S. Senate. And one day after the Electoral College put the Biden-Harris victory into the history books, Senate Majority Leader Mitch McConnell congratulated the new president and vice president-elect. Biden and McConnell also spoke today. The president-elect told reporters their conversation was good.
Told them, well, we disagree on a lot of things, there's things we can work together on. We've always been straight with one another, and we agreed we'd get together sooner than later.
We learned today that President-elect Biden and Vice President-elect Harris will be sworn into office on the steps of the U.S. Capitol next month. But because of the pandemic, attendance will be limited. An inaugural parade of some sort will be held, but it will likely be mostly virtual. And Senate lawmakers aren't going home until they strike a deal on the next COVID-19 relief bill. Senate Majority Leader McConnell made that clear today. McConnell said they'll stay as long as they need to. He asked senators to put aside the most contentious issues, which have been liability protection and funding for state and local governments. Right now, government funding will run out on Saturday, and 12 million people will lose unemployment benefits the day after Christmas. Chopper 4 was over the Meadowlands YMCA this morning as hundreds of cars lined up to get free meals. The Y has helped feed hundreds of thousands of families, along with its sponsor, the American Dream Mall, since the pandemic started, and this is their 43rd distribution event.
The lines today are actually longer than they were during the summer. In the summer, we were averaging around 70,000 meals a month, and now we're averaging over 200,000 meals a month. People are coming from up to 3 hours away, waiting in line for 3 hours to get a box of food to sustain them from week to week.
Each box has enough food for about 40 meals. The Y expects to give out 20,000 boxes to 400 families today alone.